Welcome, welcome, Dr. Ali.
Thank you.
I'm Andrea Dorocco, and I am a fitness enthusiast. I'm a woman who has been in a search for greatest health and spiritually, physically, and mentally all of my adult life. My first half of my life, I was focused on my personal fitness training company that I had for 25 years. And now in my second half of life, I've entered into life coaching and assisting and guiding and inspiring women over 40 as they transition and transform and move and evolve into their greatest space and place as well. And my offering to you with this gathering is for women curious about their health and finding their greatest health and empowering themselves accordingly with that. And one of our biggest concerns right now over the age of 40 is how our body, how we're becoming unfamiliar with our body. That body that we knew so well has made some shifts and turns, and there's lots of question marks and curiosity out in the world. And so what better way to inform us, inspire us, and guide us along is this beautiful human, Dr. Alison Cockerill. And she is a naturopathic doctor. Let me just tell you a little bit about Dr. Alison, who we call Dr. Ali. Dr. Ali is a graduate of the Canadian College of Naturopathic Medicine. And as a doctor of naturopathy, Dr. Ali believes that the healing journey that we have all experienced is unique, and therefore it's important to her that each of her patients are treated in a holistic and personalized manner. The naturopathic approach combines evidence-based treatment with individual care and the consideration that every aspect of our lives, that is mental, physical, emotional, and spiritual, impacts our overall health and wellness. Dr. Ali works with a wide variety of health concerns, but all of these, but not limited to these, such as hormone imbalances, infertility, digestive complaints, skin conditions, mental health concerns, weight management, and so much more. Dr. Ali has also met the standard of practice for prescribing in Ontario, which allows her to prescribe bioidentical hormone therapy, thyroid hormone, and perform B12 injections in IV therapy. She holds a certificate in functional and personalized hormone restoration therapy. She's a member of the Ontario Association of Naturopathic Doctors and the Canadian Association of Naturopathic Doctors. Dr. Ali operates her very busy practice at Trenton Integrative Health Centre in Trenton, Ontario. But when she's not there running a kick-butt business, you will find her on her hobby farm with her growing family of 4 young children and her husband, Steve.
Yes.
Hi, Dr. Ali.
Hello.
Yay. So glad you're here.
Thank you. Me too.
So fun to be collaborating with you and simply offering. You know, I always say women don't need to be told what to do. Yeah. Women are wise humans. But in our lives, as we get going and in our busyness, life can sometimes fog things up and we're not as clear with our knowing. And your offerings and your brilliance and your wisdom is something that I think is so needed in our world right now, as we are all stepping into a lot of curiosity as we look back at our mothers and our grandmothers and our great grandmothers and the ways that they have dealt with 40 and older. And we're now looking at life and saying, hey, maybe it's time to do things a little bit differently.
Yeah. I think a lot of women are realizing in that time of their lives, like, I shouldn't have to feel a certain way, right? Like, I don't feel vital anymore. Or, like you said, like, we're starting to see ourselves in a different light, or there are physical changes that are happening. And instead of just this idea that, we have to grin and bear it, it's sort of like, okay, well, what can I do to take this into my own hands? And so a lot of times, maybe these women don't know where to go, right? But a lot of times they end up in my office and in your coaching business, and we've had these, crossover discussions, and that sort of led us to want to collaborate and get this information out there, right? So um, just so women kind of know that there are options and there are a lot of things that they can do to optimize their health and wellness in this space of hormonal change and, like you said, transformation, not just on a physical level, but on a mental, emotional, spiritual level as well.
Mm-hmm.
So yeah, I think it's going to be an exciting little podcast, and we can kind of chat about all the things, hormones and women's health.
Yeah. Adventure. It's kind of neat. We'll let everybody know that Allie and I both we have some comparables. We are about 15 years apart, and but we both can have these great conversations and understandings, as Allie has this wonderful knowledge and offering in her naturopathic business and education. I've lived it. And this was also how I came to meet Allie as well. She was and is my doctor. And one of the really interesting things, too, that we talk about is both of us running a business and having 4 children, and the dualistic life of doing it all and doing it the best we can, because we didn't get into these shoes without having that thought and feeling of living in excellence and striving for our best and our curiosity. However, through that process, particularly by the time we hit late 30s, early 40s, it's really starting to wear us down. And that is really where Allie and I thought would be the best way to have this chat, to start to offer to other women like ourselves. And we're hoping that we can also give a variety of perspectives, such as our age, such as having our children, being business owners, and Allie's, of course, approach from the medical perspective, her living personal experience, and then my perspective coming from fitness and life coaching and personal experience already being through my 40s and into my 50s now. So with that in mind, why don't we start off, Allie, when your patients come to you, as you were just mentioning, a woman is coming to you in her late 30s, early 40s. What sort of symptoms? Who is that woman that is coming to you, and what are her symptoms, and how does that conversation go?
Yeah, so a lot of times, like, I think, like, sort of the avatar of that, like, 40s woman, right? Um, that I see a lot is, just feeling tired, fatigued, has probably, sought maybe an opinion from, her medical doctor and had some baseline blood work, and, often everything is looking normal. So then, she's like, I'm not sure what's going on. I'm feeling tired. A lot of times I will hear things like, my periods are horrible. They're very heavy. I'm not sure what's going on there. I've gained weight, or I feel like I can't lose weight, even doing all the things that I used to do. Feels like it came on kind of overnight. I'm not sleeping very well, oftentimes feeling a lot more anxiety. So whether it's over just day-to-day work stuff or like kids or whatever, but just feeling a lot more anxious than maybe they ever have. Maybe they've never had anxiety and that's new, or maybe they have, but it's worsened. So that's really common. And so this is sort of like a pretty broad summary, right? Like, I mean, there's variations of that, but it seems to be a very common story. Um, and then when we start having that conversation about all the things that I ask about as a naturopath, diet and lifestyle and stress management techniques and movement, it really often is just like such a busy time of life for many women. And again, not to generalize, this is just sort of what I see as a thread, right? So, you know, they often have preteen, teen, or like early adult children. Um, they're in the middle of their careers. They're at like a really busy place. They're usually in a good place in their career, whether they like their job or not, right? It's sort of like they're in a busy space. They may have a partner, a household to look after. And a lot of what I see is sort of they've fallen to the bottom of their own list because there's so much going on. Have to manage work, have to manage the kids, make sure everyone's fed, make sure, and again, I find, and again, this is my view is that I see a lot of these women, but I find a lot of times they're also responsible for that invisible workload of like knowing if it's polka dot shirt day at school and like all of that, right? So it's like not only do you have like meal planning and work and household and kids, but it's like the invisible kind of tasks of sports management and driving kids and all the things. And so then when I ask about, okay, so like you're packing everyone's lunch in the morning, what do you eat for lunch? Well, oftentimes I'm too busy at work. I just have a coffee or I run out and get some fast food because like I skipped breakfast. And so it just comes up, right? And so we end up in this cycle of being so busy and doing all the things probably amazingly well, except for looking after ourselves, right? And the body will only tolerate that for so long. And in our 40s, hormonally, there are also changes happening. So, like, irregardless, right? I do have some women who come in and the lifestyle pieces are great. Self care is there, sleep is good, but there's hormonal changes happening there too. So, that plays a big role. And sometimes that can leave women feeling like there's a lack of control because, if they've inquired about it, or if they've talked to their friends, they're like, oh yeah, me too. Like I can't shed that extra 10 pounds. Like I'm not sleeping well. But they're not really sure like why, right? What is that shift that's happening? Yeah.
Yeah, you're making my hands sweat just rhyming it all off and remembering that feeling. And I used to always say that I'm on a treadmill of life, and I just kept going and going, and the only way in my world is to get off. In order to get off it was I had to be thrown off of it. And I think that's also, Ali, that has been one of my major focuses to take this step looking back, talking to my younger self, my 40 something self. I wish that I could have done that. And so this offering, this talk, and the information that I'm hoping you and I can bring to other women is exactly that conversation to that woman and saying, it's okay. You're allowed to get off. You can press pause on the treadmill.
Yes.
And I didn't see that as an option. And I'm sure there's many, many women out there who just can't quite wrap their heads around how to do that. We call that the martyrdom of life. And we feel that we simply have taken on all of these responsibilities and we really are the best person to care to these children in our life in this world that we have created. And and it really is a tricky situation, but the base of it is self-care
Yeah.
and self-love
Mhm.
and self-compassion, and allowing, because, and keeping that in mind, that we are better moms, partners, colleagues, friends, sisters, daughters, when we've taken some time for ourselves. It's not selfish, which has been a story, and that is sometimes very deep rooted in us, that selfish piece. And maybe we can elaborate on that a little bit more, but it certainly is this rooting up. It's almost like this earthquake. It's starting to rumble a bit in the beginning of our 40s,
Yeah.
and we start getting a little wobbly. I say it's the tree, and that tree starts getting a little bit shaky, and we start recognizing, jeepers, I've been doing this for the past 10, 15, 20 years, and I'm recognizing this just isn't working for me. And it's okay.
Yeah.
Where some of that. So stepping into that, Dr. Ali, what would be the first step? So let's say I'm not coming in to see you, but everything that I just went tick, 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 tick as you're speaking, and I'm going, oh my gosh, that's me.
Mm-hmm.
What would you suggest for the first step to, owning my own health, owning, taking charge of, and learning and understanding what's happening to my body, to my mind, to my spirit, to my energy? What would you suggest for my first step to starting to heal myself and move myself into a greater self?
Yeah, it's a good question. I think looking at, and this seems kind of blanket, but like the stress management in that cortisol is such an important piece of the puzzle for hormones. And so it's trying to figure out what are the biggest drains or pulls or stressors on my cortisol system that I can control, right? So that I can control without, because I also think like we can't expect someone to do a complete 180, on their total lifestyle. But the first step is recognizing what are some of the habits that I've accumulated in these last 10, 15, 20 years that are actually not serving me. They're creating a problem with my stress hormones. They're creating the situation where I'm feeling more stressed all the time. And that's in turn going to impact my female hormones, which are already changing, and taking hold of those things. So I think if we want to like maybe even understand, so what I often say is that the 40s is sort of, this perimenopause, which I'm sure a lot of women have heard of this term. That's where it's kind of starting. And that's sort of like the 10-ish years leading up to menopause. And the big hormone players in this space for women are progesterone and cortisol. Okay. So everyone, I think, like thinks about menopause and perimenopause, and it's always like you could think about estrogen, which we will talk about
Mm-hmm.
in future episodes. But in the 40s, it's really the progesterone and the cortisol. And so this is where I think identifying the stress pulls and trying to manage those actually have a very foundational effect on our hormonal balance as well. And so I think we can say a couple things. As soon as we're in our mid 30s, our progesterone starts to sort of decline because most women start to have cycles where they're not releasing like a good quality egg. Okay. And that's what creates a progesterone level. That's a happy progesterone level. And the more that happens through our cycles, the less our progesterone is where it used to be. And the more we're going to start feeling symptoms associated with that. And so progesterone supports nervous system health, a calm brain. It's a precursor to a neurotransmitter called GABA, which makes us feel really calm and like we can handle stress like a pro. So when our progesterone is in its prime in our, 20s and early 30s, like we are usually kind of managing through stress well. And then as it starts to come down, we start to see more anxiety. We start to see more problems with sleep because progesterone is sort of our good quality sleep hormone. We start to see the changes in the periods that I mentioned, the heavy flow, because progesterone is a sister kind of hormone to estrogen, and it keeps that sort of lining of the uterus under control in a normal cycle. So the progesterone is already starting to dip for most women in this phase. Interestingly, too, is that cortisol and progesterone have an interconnected relationship. So this is where the stress piece. So if you're, the woman who is, work, has kids at home, is running the household, feeling stressed, not sleeping well, not eating well, and you're stressed a lot, it's going to also even further negatively impact your progesterone levels because they speak to each other. So that's where managing the stress piece is also going to help with the progesterone piece. So, I think some of the bigger things that I focus on with stress management would be just, again, like I said, if someone's drinking too much caffeine, that's going to ask the body to produce more cortisol. If someone's drinking alcohol at night because, they can't wind down, they're not sleeping well, they feel stressed. It's like, they're looking for that dopamine time at nighttime when the kids are in bed. Well, that's going to actually ask the body to raise cortisol. So it in the immediate feels like it's helping you because the caffeine. But at the end of the day, it's really not great for your cortisol, which is not good for your hormones. So it's identifying these pieces. And that's not it for everybody. Some women end up snacking in the evenings because that's their dopamine hit, right? For like winding down or whatever it is. But oftentimes they're maladaptive behaviors, meaning they don't actually support our goals of feeling our best. So definitely those lifestyle factors are really huge in the 40s to protect your hormones that way.
It's amazing. Like, it is wild. Everything that you're saying makes sense, all of the different components. Can you step back just a tad and explain a little bit more about cortisol?
Mm-hmm.
What gets it going, what drops it, what spikes it? And
Yeah.
again, that parallel to, did you say our
Progesterone.
hormones and
Yeah.
progesterone?
Yeah. So cortisol is kind of the better known stress hormone. So our adrenal gland lives just above the kidneys and it secretes cortisol as well as other hormones, epinephrine, norepinephrine. But it's basically important for secreting cortisol, which is our stress hormone. We do need cortisol. It keeps our blood pressure normal. It helps with blood sugar stabilization. It gives us energy in the morning. But generally speaking, it should be high in the morning and slowly come down until it's at its lowest at bedtime, and then it kind of, restarts. The problem is a lot of things create too much cortisol in the body. And so when you have too much cortisol in the body and too much stress, it's actually going to create then problems. Too much blood sugar, stimulation and dysregulation, inflammation. It can create inflammation. It can pull. So backing up, when you ovulate, it's the ovaries that make the most of our progesterone. However, the adrenal gland does make some. And your adrenal gland can make cortisol from the precursor of progesterone. So when you're like in a high stress all the time space because you have a high stress life, you are at risk of impacting the progesterone levels. And again, like we do know that high stress environments can create a missed cycle in women. Like most women are aware of this, right? Because it does impact female hormones. And I'm not going to get into all the biochemistry of it, but they just talk to each other. So high stress all the time, it's going to potentially negatively impact progesterone as well. Which is going to then worsen all those other symptoms that we talked about. And too much cortisol is just going to create like a lot more inflammation. It's going to potentially create, aging because it sort of impacts our While it will impact our microbiome, it can potentially impact things called telomeres, which are on our genes. So it's very intricate. So stress, like we know, stress is bad. People know that, right? But sometimes we don't realize all the things that create stress, right? And so, of course, the day-to-day things, you're stressing about your child's health or work deadlines or, the commute to work was stressful or whatever. Those are stressors. But there are other things that are stressors. Skipping meals long term, right? Yeah, I know intermittent fasting is a thing, but it's not always the best for our hormones, depending on where we're at with our cortisol. Um, yeah, so skipping meals, things like too much caffeine, caffeine will spike cortisol, too much alcohol, alcohol will spike cortisol. So there's a lot of pieces there, right? And our nutrition too. So if we're nutritionally deficient in certain things, that's going to be a stressor on the body. It's not maybe a cognitive stress, but it's a physical stress. So it's still going to impact cortisol levels.
Yeah. Wow.
Mm-hmm.
It's so as we're talking, it seems like everything, and as we're in our 40s and all of these symptoms are coming into place. If we were able to reduce perhaps even some of these phantom stresses that we're not even aware of, or how they're actually affecting our bodies, because we've been able to do it fine for 20 years
Yeah.
or
Mm-hmm.
however long we just put on our big girl pants and go.
Mm-hmm.
If we perhaps maybe took a moment and just simply looked at tools that might help assist in these stressors, and working on looking at our lifestyles and making some tough decisions, saying no when we really feel like we should say yes, and
Mm-hmm.
saying yes when we feel like we should be saying no.
Mm-hmm.
What do you think about that? Like, where do you go from here? What are some practical points that we can add to our lives?
Yeah, it's a good question. And I think a lot of it is sort of like you said, sometimes the lifestyle pieces, which I think like the health coaching and like the mental emotional side of things is really helpful. So sometimes for my patients, I recommend, counseling or things like that, because I think working through our own values and our own tendencies is important. Like you said, the ability to say no, building in boundaries. I also think a lot of women that I speak with, it's sort of like, well, if I take that 30 minutes to like get my steps in every day, which is movement is crucial, helps mental health, helps our body composition, obviously, it helps with everything, right? But if I take that extra 30 minutes a day to get my steps in, XYZ is going to go to the wayside. And like, there just comes a time where it's like, that's okay though, or like, well, my kids need XYZ. And for me, like, I also think recognizing that modeling self care is so good for your kids. I will say to my kids, Mommies, this is my time. I'm here, but right now, like, this is my time. So if you need a snack, I will be there to get you a snack in 27 minutes. Like, and this is okay. This is okay. It's okay to say I have a boundary right now. It's important that I'm looking after my body so that I can be the best for you as well. So I think just reframing
Brilliant.
sometimes and sort of getting rid of that idea that it's selfish to take the time or it's selfish to say no. And there's another aspect where sometimes I find you also have to sometimes recognize when you're making excuses to like not do things, because sometimes I see that like, people have an excuse for every solution. So it's like you only have, like, you can have a variety of solutions to the same problem, but you can make an excuse for that, right? So it's just owning that piece too, which So this is where like mindset shifts come in. There's always a way that you can build in some more health. It's just finding the way, right? And there is a way. It's just, and again, that's part of my job with my patients is trying to find what are the things that are going to make the most impact that are actually going to be sustainable. And so, part of it is that. The other piece would be really prioritizing like the foundation. So like we said, movement, and looking at how that might affect our hormones. So I don't want the 40s woman who's stressed and has a bazillion things on her plate doing an hour of cardio every day and skipping meals, because that's going to skyrocket her cortisol. Cardio is wonderful for cardiovascular health and heart. I'm not saying don't do cardio. It is really important. I do cardio, but like it's not my focus. I would prefer strength training and prioritizing eating well. No restrictive diets. Don't, do all these kind of like fad diets and things like that, because they're not sustainable. And this is what frustrates women, is that they try it. And most of these women are like go, go, go women. So they're good at it and they do it for a while, but it's not sustainable. They don't see lasting results. And part of it is just because there's hormonal imbalances happening and they're trying to build it into an already stressful life. So, it's sort of like my first thing is hit your protein goal every day and move your body. That's actually super crucial for your hormones.
What's the general range for protein that you would say to that average woman? How much protein should we be having?
I like 80 to 100 grams.
Any particular form? Does it matter to you?
It really doesn't. Like, I don't love like protein bars and things like that because they tend to have like ingredients I don't love. I'm okay with doing a good quality protein powder in a shake as an added, but not more than, once a day type thing. I would rather it come from whole foods. And obviously, as like a disclaimer, none of this is medical advice. It's just informational. And obviously, everyone has their own needs. So definitely checking in with your medical provider, your naturopath, or whoever you see on your own protein needs. But a general rule would be 80 to 100 grams is sort of where I like to have it daily, which can be hard because a lot of women I talk to are maybe hitting like 40 grams on a good day. So again, it's not like I would expect a jump from 40 to 100, overnight. It's sort of like, let's work up to a better protein intake. Because that's going to really help support hormones long term as well, because we know that supporting muscle mass is really important for healthy aging. So again, something a lot of women will sort of start worrying about in their 40s is like, the physical changes that happen, like, oh, I'm starting to get some gray hairs, or I have more wrinkles, or like those things, right? And so if we think about healthy aging, it's like you have to be eating well, sleeping well, hydrating well, right? Those are the foundations. And so part of that is really supporting muscle health is crucial moving into perimenopause and menopause, especially to preserve healthy body composition and healthy joints and all of the things. So
It's huge. It's huge. I can't believe how impactful that has been, focusing so intensely on strength training in my late 30s, early 40s, and now being 53. It's not so much, I do different exercises, but however, my body has a recognition of what it was before. And I really do feel strength training is the major factor. And strength training, I found, almost encourages me to eat better. I think I'm doing all this work. I need to feed that body. And could you talk a little bit about, which I always remember, when I haven't had enough protein, I feel like I want carbs. Or I go into a sugar like I just need. And I almost every time, it's a day, a moment, a period of when I haven't been eating well and I haven't had enough protein in my diet. Is
Mm-hmm.
that correct? Or is
Yes.
that,
No, 100%. Because, and again, this comes up a lot in my conversations around low energy and fatigue, because, there are certain amino acids, which are just proteins, that are essential, meaning you have to acquire them through diet. So if you're not eating enough protein in general, you're not getting the fuel you need. Your brain is going to say, we need fuel. And the easiest fuel for a brain is sugar, right? That's the fastest kind of fuel. So you're going to have cravings, and it's going to usually be sugar and carbs, because carbs, like non-complex carbs are going to turn basically to sugar in the system, right? So yeah, eating protein will definitely offset cravings. It also helps to sort of slow your absorption, right? That and fiber. So eating fiber, protein, and fat is crucial. Um, and this is where patients who are eating too many carbs and not enough protein, you just get in this cycle of craving, right? Because that's what your body's been used to. So definitely that's a big thing that I recommend, especially for patients who find they have that afternoon crash where it's like my energy just crashes and I start craving, and at work I'll like go for the donut or the cookie or whatever, right? Because that's probably, and then when I look back, I'm like, well, you skipped breakfast. So you're definitely protein deficient at that point. For your daily intake. But yeah, it definitely helps with cravings 100%.
what happens if we just did a little quick thing here right now? So the tough thing is in the morning. We're getting things ready, whether we have kids or we don't. We're in the madness of the morning, whether we're a morning person or not.
Mm-hmm.
The quick and easy, where in the past I've always suggested to women who are just finding that their self-care is so low, I say get a good quality protein.
Mm-hmm.
And there's lots of great proteins out there who also, there's also additional nutrients involved in it. And I say, even if you can't put it in a shake, you
Yeah.
do a shot. I call it my shot of protein
Yeah.
with a big glass of water to get that. I always kind of say it's like a base, it's a coating in your belly and throughout your system. And then, of course, my next one would be eggs and just boiling up a bunch of hard boiled eggs. And I have a girlfriend who always talks about carrying her baggie of eggs.
Yeah.
They're not the best smelling things.
Yeah.
However, I think of them as such a natural wonder. What else would you suggest, or what are your thoughts on that? So our kind of
Yeah.
our quick and easy for the women that are running every which way.
Yeah, those are some of my two main go-tos as well. For protein in the morning, I do feel like if patients can tolerate dairy, doing like a 0% plain Greek yogurt, high protein with, I'll often do like a tablespoon of nut butter and some berries, like frozen berries even. And sometimes, honestly, like I have 4 kids, they're young. Mornings are hectic. I have to get to clinic on time. Like, sometimes that yogurt is going in like a travel container and I'm eating it in the morning before I see patients. It
Yeah,
doesn't have to be
yeah,
perfect. Or I do a smoothie and I take it and I have it on the drive, right? A lot of times, though, the other thing is like, honestly, doing up like a couple scrambled eggs with, I put like some cottage cheese in for extra protein. It takes me like 3 minutes. And I probably don't have the best, what I call diet hygiene when I'm eating them. This is something I'll talk to my patients about a lot, right? Like you should be calm when you eat and chew your food, 30 times per
yeah.
bite, like all the things.
Sit
Okay, let's
down.
be real. It doesn't always happen. And
Yeah.
I rather eat my scrambled eggs quickly than skip it, because
Yeah.
if we're being totally transparent too, like in the beginning of my practice when things started getting really busy and I had young kids, I was like trying to keep my head above the water. Like, and I was like, you know what? I'm going to end up like feeling terrible. I'm wrecking my hormones. My cortisol is terrible. And so it's sort of that view, like I needed to shift in on myself too, right? Like you got to practice what you preach, which I'm sure, you've been in those moments at times in your life as well. So
Yeah, it is a neat thing, but I feel like there's such a power in sharing story because I think women were more connected than we're not.
Hmm.
And when we can hear that, oh my gosh, you look so together and you're so smart and you're just doing it all. I don't know how many times people say, how do you do it all?
Yeah.
It's like, oh,
Yeah.
no,
Yeah.
because I don't feel like
Yeah.
I'm doing it all at all.
Hmm.
Um, and I think that kindness that we can offer to everybody else but ourselves is something that I certainly, when I talk about talking to my younger self, and that sort of care. I'd like to just step back to that other component that we're talking about, strength training. We used to think when we trained people, we would always have people do an hour long of a workout. They would come into our gym and do a half hour of cardio and then a half hour of strength training. As life has gone on, I've actually figured out whether it's Peloton that brought it in full force, so you can get this great workout in 20 minutes for strength or on the bike, or they're
Yep.
right. But strength in particular, I have honed in on my workouts as well to closer to a 20-minute, 30-minute, sometimes it's a 10-minute workout,
Yeah.
and it's just the movement that also puts my head in the game,
Hmm.
and just trying to find that little piece. The other little bit when it comes to fitness is when we're taking our children to practices, to tournaments, finding that time, walking the stairs, dropping them off at practice, and going up to the track and walking the track, or paying the $10 so you can go into the gym and do a few exercises.
Yeah.
Um, and again, I think there is that interesting balance. Strength training is extremely important, but there is the other component of sometimes it's a yoga flow that is what I need. And I think that's the other piece of really connecting with what we really, really need versus what we think or we should be doing. But
Yeah.
those
And I
long,
think
long
like
cardios,
the shorter strength training and things like yoga is better like from a cortisol perspective, in my opinion, like
mhm,
than the intensive cardio. Intensive cardio for some patients it's fine, like and it works for them. So it's not a blanket sort of thing, but just generally, I also think building in 20 minutes of a weighted workout is so much more like attainable for women who are struggling to get any movement in, right? And so the other thing I would say is I have definitely had conversations where it's like, well, I can't do yoga or meditation because like I'm just too, like I prefer high intensity. And I'm like, yes, you are probably the person that needs to do the yoga and the meditation. And that's me. I have, like that I get it. It's like that type A, like, personality maybe. Um, but oftentimes that's your signal that like, okay, this is a challenge for me, so it might be something that my hormones would appreciate.
yeah, I can relate to that. I remember many, many, many a times just going, "Oh, yoga, really? What's
Yeah.
in that?"
Hmm.
And that really is a screaming moment. But also, again, know that you're not alone. It's that thought. Meditation's also another very interesting component. And thinking that you have to sit there and you just have to be in almost like a zero space. I
Hmm.
used to get a babysitter, and I would get a babysitter for an hour and I would go for a run and I would call it my running meditation. And at that time, it had many components to it. It wasn't super fast. It was to be outside in the nature, listening to music, which I find music very soul soothing for me.
Hmm.
I also was getting a sweat on. I'm a very physical person. I love physical exercise, and that was a great outlet for me. So it doesn't have to be a run; it could be anything. But I would get a babysitter. I'd go to the dollar store, get piles of stuff from the dollar store for crafts, dump the babysitter for
Yeah.
an hour, so I
Yeah.
then can go have my space and my time. And I came back a better mom.
Yes.
I was covered in sweat, but who the heck cares? I just had that and that breath. So we kind of think that meditation has to be, okay, I'm sitting cross-legged quietly with my music and my candles going and everything else. That's not necessarily it. And there's many apps out there. There's many tools out there. There's many um, components of just sitting quietly. It's just that combination of centering yourself and slowing your breath down
Yeah.
and relaxing that nervous system, which again is so amazing how that could we could come full circle to
Yes.
how you were explaining from the adrenals to our hormones and how they're so interconnected through the nervous system.
Hmm. I know. Yeah.
It's
We're
wow.
a whole, right? And that's where it's like when I have these conversations, with women, and sometimes I'm like, we really need to work on your nervous system. And then just explaining how that's going to help like with so many other pieces, right? But yeah, it's super, super important. And I think the other piece to that kind of comes to mind for me with what you're saying about how you prioritize taking that hour is that a question that I often ask is like, what do you do for you? Like, what do you do for you in a week? And like sometimes, like, people start crying because they don't know. There's tears. It's like when was the last time someone asked me that? Because I don't, so often it's like, I don't know, aside from like having a shower by yourself without any kids in there doesn't count.
Maybe.
Grocery shopping alone doesn't count. Like these things don't count. These are like things that need to be done, right? It's like, what do you do like for you that makes you feel good, that makes you feel better? And so I think a lot of times, like by our 40s, we've like maybe lost some of that, and then that can translate into when we talk about 50s in our next episode, where it's like in that sense, if you don't start to build that in your 40s, your 50s might feel even harder, right? Because,
Oh yeah.
You're in a different space and you don't maybe know exactly who you are at that point. You've lost connection with yourself a bit.
Yeah, I think Allie, you are absolutely onto it, and you step into this
Mm-hmm.
remembering
Mm-hmm.
of who I am.
Mm-hmm.
It's a wonderful thing, and again, the more conversations and recognizing and allowing and encouraging other women, as I like to say, fellow queens and straightening their
Mm-hmm.
crowns. So can we step into a little bit on what other ways, more maybe a little bit more specific
Mm-hmm.
action to guide women, give them some tools, such as perhaps supplementation, which
Mm-hmm.
I've always found has been a key component for myself, and then maybe blood work and some different things that we can be
Yeah,
looking
for
at to
sure.
where we're at.
Yeah, and this is often again a conversation that comes up, and I think there are certain things that are like more indicated at this phase of life. Again, making sure that you kind of pass it by your own practitioner, right? This is just sort of things that come up a lot
Right.
um, for me. But yeah, so definitely for nervous system, sleep, hormones, I really love magnesium. Magnesium is super, super crucial. It's probably my favorite mineral. Probably. It's up there. There we go.
Go. Just so happen to have some
Yeah.
here. I don't know why.
Yeah, exactly. Um, really great. In many ways and has so many benefits. So I think that's something that should be considered for a lot of patients. and something I
Allie,
use a lot.
what are because it's something that I have Sophie taking as well, who
Hmm.
she's 20. So what are some of the benefits that
Yeah,
maybe just a
so
couple?
definitely I'll use it for improved sleep quality. I have found it can definitely help with like that anxiety piece, that nervous system piece, because it does tend to calm things down. It's also wonderful for cardiovascular health. So again, like I guess we're kind of focusing a lot on the hormones, but like in our 40s, like our body is changing too. And it's also going to be expressing some of that high stress lifestyle or maybe some of the things that we are doing that aren't serving it well. So magnesium is great for cardiovascular health as well. It's sort of a big, one of the biggest minerals for cardiovascular function. So really important there. Bowel regularity. So again, gut health is like probably a whole topic we could talk about gut health and hormones. But it can help with bowel regularity. So obviously that's going to be important from a hormonal standpoint when there's a link between gut and hormones, and there is. And also can help with things like dysmenorrhea, which is painful periods. And I often do find in our 40s, the periods are changing quite a bit and tend to be heavier, can be associated with more cramping and things like that. So it can be indicated that way as well. Um, Vitamin D is another big one at this stage. I mean, I think most people know the importance of it. A lot of people that I talk to are sort of already taking it, or their medical doctors have mentioned it. So something, but thinking about hormonal changes, bone health is an important piece when we start to see changes in our hormones. So vitamin D is really crucial for that. It's also really important for mental health. So thinking about the changes that can be associated with stress and hormonal changes and anxiety. From a herbal remedy standpoint, there are some herbs that I use to sort of help gently support progesterone production at this stage. Those are usually a little bit more individualized, but some could be like, you know, Chase Tree or Vitex I'll use. And again, like some of them are more Chinese medicine based and can kind of help with like that cortisol side of things. I really like Schisandra berry for some patients. So definitely I use quite a bit of herbal medicine. Um, and I think too, like definitely maybe if we're talking about like baseline, ensuring omega-3 levels are in a good place too. Just because from an inflammatory standpoint, yes, it's really important. And most people are not eating enough fatty fish to get adequate omega-3. Even if you are eating fish multiple times a week, it has to be the fattier fish that really have high amounts of omega-3, and just generally helping with inflammation and healthy aging and all of that as well. I
Mm-hmm.
think those are sort of like some of the foundations. Obviously, sometimes I would look at things like B vitamins and maybe collagen as well, but it would be dependent on sort of what was going on for that patient as well. Um, so those would be some of the kind of like main things in terms of blood work. So as a naturopath, I can order blood work. It's just not covered through OHIP in Ontario. So I do quite a bit of blood work with my patients, and or we can work integratively with their medical doctors at times as well. So in terms of blood work, things to kind of really look at the basics for sure. So cholesterol levels, liver function, kidney function, but some others, definitely thyroid function, because the thyroid is a gland that lives sort of right here and is really important for metabolic health and so important in overall health and tends to be more sensitive to hormonal changes. So I tend to see a lot of times, like, you know, puberty or postpartum, pregnancy, menopause tend to be areas where the thyroid has a potential to sort of become a little bit more out of whack. So checking in on thyroid function. And again, I will often run more than just TSH, which is the main marker. You want to look at the free thyroid hormones as well, T4 and T3. And for some of my patients, I will look at antibodies, which are just markers of inflammation around the thyroid or immune sort of response. So definitely thyroid. I often will get a baseline of vitamin D, which is not really routinely done in Ontario. But it's good to know where you're at to properly, dose the vitamin D. And B12 as well are sort of big ones. And then obviously blood sugar regulation is huge. So you want to make sure that your doctor is checking in on blood sugar regulation as well at this phase. And this gives you a nice baseline. I don't always test hormones in this population, perimenopause, but I do at times because it depends on the symptoms. When we do blood work for hormones, usually they're going to come back to say, this is where you're at in this phase of your cycle, especially if you're still having a regular cycle. So not always really helpful, but sometimes I will test them in the serum or the blood just to, if I'm thinking about using bioidentical hormone replacement, then I always do that as a baseline. We can do things like the Dutch test, which is a urine testing or saliva testing, to get a little bit more of an idea of sort of how you're breaking down and metabolizing hormones. And that can be helpful in certain situations as well. And again, it's very individualized to what's going on for that patient, but there's just a lot of options. So I think sometimes patients will kind of want to work with a more functionally trained doctor or a naturopath. Some people's GPs are doing a wonderful job with this too, in terms of looking at a little deeper into like the hormonal pieces and sort of more those functional markers, in terms of like a deep thyroid panel and things like that. But definitely a conversation to have with your provider for sure.
Mm-hmm. It really is wonderful seeing GPs and OBGYNs that are looking at a more forward type of medicine and really embracing the perimenopause and the menopause component. However, it can be super difficult to get into an OBGYN.
Mm-hmm.
And then of course it's all dependent on what your GP theories and beliefs systems are pertaining to menopause and peri, and that can add a whole other level of frustration, which is where your work and your expertise is such a refreshing option.
Mm-hmm.
You listen, you see, and taking that curious approach of, okay, well, let's see. And you once explained it to me that I think you explained it that the hormones are a symphony.
Mm-hmm.
Is that how you explain that?
Yes.
Can you say that? Because I think I'm guessing as you explained yourself as A-type, and I certainly could put myself there too. I often will see a problem and I'll go right into fixing it. And what exactly do I need to do to fix it?
Mm-hmm.
And when you mentioned, well, it's all a symphony, it literally had me stop and go, holy cow, Andrea, get with the program and recognize, just as we've already spoken today about how much of a symphony is the symphony that is happening in our body, our mind, our soul, our spirit, our energy levels, everything. And but you did explain it something along with the hormones.
Yeah, I will often say that it's a hormonal symphony. So, progesterone doesn't work in isolation, and neither does the thyroid hormone, and neither does estrogen, right? Like estrogen and thyroid have an intimate relationship with each other. And, insulin and testosterone can be interconnected. When one is off, the other can be off, and those things can impact each other. And so you're right. It's never just, okay, progesterone is the only problem, right? It's not really as simple as that because the body is so complex. There's so many feedback loops. If you ever, there's this whole steroid cascade. And it's wild when you look at it, like how all the hormones interconnect and can interconvert and interchange, and how everything is connected. So that's exactly it. It's a hormonal symphony. And the job, I think, as a naturopath for me is just sort of, be understanding and listen to the symptoms and take the history and do whatever diagnostics we need to do in terms of blood work or, things like that. And figure out where we need to focus to have the most impact on all of the pathways, right? Mm-hmm. So that things can start to just be more well balanced. And often that is changing the foundational things first, which are the hardest things to change, but they make the biggest impact.
Mm-hmm. It's really interesting too how we're all the same, but yet we're so unique. Mm-hmm. And that sameness perhaps can bring us together and recognize and support each other. And yet we have to also look at individually what works for us and what we're able to do, and balance within our lives, which really is what we're hoping that we offered you all today, mm-hmm. with a variety of possibilities, information, and hopefully some tools that you can take with you as you continue on this journey, and staying very kind with yourself that this really is a journey of life and nothing's going to happen instantaneously, as much as social media and the internet would like to think that's how life goes. The reality is it's not. And when we're really searching for our truest self and rooting ourselves, we're looking for that symphony within us, and mm-hmm. what this whole flow looks like. So thank you, Allie. Once again, wonderful, wonderful. And just like that, we will see you all again soon, and we'll be talking about more on women's health. And the next time you see us, we'll be talking about being in your 50s and embracing that symphony once again.
Yes.
Thank you.
Thank you.